In diabetes, one of the things we're most concerned about is smoking. These two things don't go very well together at all. The main thing about diabetes, although we are concerned about controlling blood sugar levels, is in the longer term, this does harm to blood vessels, as does smoking. And the combined effect of smoking and diabetes causes a very, very high risk of accelerated damage to those blood vessels across the body. So one of the things we're absolutely prioritizing is that people with diabetes shouldn't smoke or should help to stop smoking. Type 1 diabetes is a condition that normally comes on in younger ages, and so you'll have it from a younger age, but you might have it for quite a long time. Traditionally, type 2 diabetes comes on in slightly older ages, though again, nowadays we're seeing it in young people as well. Both of them lead to high blood sugars. Type 2 diabetes frequently can be associated with other risks. Both of the conditions, though, they can both lead to damage in the longer term, in the eyes and the kidney and the heart and in the legs. And that is, as I said, related to damage to blood vessels. And they have that in common. Cardiovascular, basically cardio means heart, vascular means blood vessels. So we're really talking about the heart, the brain, strokes, blood vessels to the legs, blood vessels everywhere. In diabetes, you can get higher blood sugar levels, and they, over years, can cause accelerated damage to these blood vessels. We can prevent that, we can stop it from happening by good control of the diabetes, but that is the risk. If you have any other risks on top of that, particularly smoking, but also high cholesterol, high blood pressure, these things then combine to cause even more damage to those same blood vessels. So by really effectively looking after the diabetes, and by addressing, in particular, smoking, also blood pressure and cholesterol, we can do a lot to prevent damage to the heart, to strokes, to the brain, to other blood vessels across the body. So we know smoking is bad in everybody. The level of risk in somebody with diabetes is considerably higher than even that which in somebody without diabetes. It's absolutely vital. It's one of the key things we want to do, is to let people know the extra risk of smoking and diabetes and the mechanisms by which they might try and stop it, because we know the difference that's going to make to their future risk of problems. Wherever you see somebody for support about your diabetes, whether it's your GP, whether it's the hospital, whether it's in the community, any healthcare professional you meet will be able to direct you to some support. So please feel free to ask.